Hello, my friend, and welcome to the podcast today. So, we know that heart disease is the number one killer of women, and especially once you've been through menopause, this becomes a big issue. So, I'm thrilled to have today Dr. Tracy Paeschke from Colorado to talk to us about preventive cardiology, how to prevent heart disease. And you might think you know everything about this, but we're going to talk about some very interesting things, including the cholesterol level of babies. So I hope you'll find this a very interesting episode. So thanks, Dr. Paeschke, for being here today.
Thank you.
So Dr. Paeschke is a cardiologist in Colorado Springs, but also works online. And can you please just tell our audience a little bit more about yourself and how you ended up doing preventive work instead of sick work?
Right. Sure. So thank you for having me. And so a little about myself. I've been a cardiologist for 25 years, taking care of sick people, right? So when people have their heart attacks or heart failure or arrhythmias, and then, you do that for long enough, you realize there's this whole period of time, years, that we could have intervened and helped people prevent those events in the first place, right?
Right.
So that's what made me sort of pivot my focus. How do we educate people about heart disease, which, like you said, is the number one killer of men and women? A lot of women don't know that, but it kills more women than all forms of cancer combined.
Mm.
So how do we get the word out about that? And then how do we help people prevent these events? Because sometimes your first cardiac event is a fatal event. So people didn't know they even had an issue before they die of a heart attack, right?
Right.
So that's my focus now. So like you mentioned, I see people, I have an office, and then I see people online. So just trying to make it, because it's hard to see a cardiologist. And when you do get in with a cardiologist, usually it's because you're having a problem, right?
Right.
So it's not, again, talking about the prevention piece. So that's what I focus on.
Nice. And we think about, I think sometimes we think about men because they get it earlier than women do. So can you talk a little bit about that and what the perimenopause and menopausal transition means for heart disease for women? Because that's most of our listeners.
Right. So that's right. So even though heart disease is the number one killer of men and women tend to have their heart disease a little later because we do get a protective effect of from estrogens.
Mm-hmm.
And so as women start transitioning through menopause and then become postmenopausal, their incidence of heart disease equals that of men. So women tend to get their heart disease later, and they tend to get sicker with it. And that's, has a number of causes. Often heart disease in women isn't recognized as heart disease, right? And a lot of the clinical trials that study heart disease have excluded women historically. So it's multiple issues. And again, that's why it's important for us to advocate for women, right? And to educate women. Because you have to be your own health advocate, right? No one should care about your health more than you do. So this is part of being knowledgeable about health and speaking up for yourself. You know your body, right? So if something is different or not right, you have to advocate for yourself.
Right. And I'm just going to get up on my soapbox and say it bothers me when people say that women's symptoms are atypical because if half the population or more has those symptoms, then is that really atypical?
Right. Not typical for a man, maybe, right?
Yeah. So, when we used to say that it was the number one killer of women, I thought, well, you have to die of something. And then I realized there's a difference between you living to be old and your heart stops beating and cardiovascular disease, right?
Right. That's right.
So it's worth preventing, right?
Yeah. So this gets to the meat of what I like to say is we want to we have a long lifespan, right? So we want to live to be 100, but we want to live to be 100 in good health. So we want a long health span as well, right? So, dying of, an arrhythmia in your sleep when you're 95 is one thing, but having a heart attack when you're 60 and then having part of your heart damaged and then getting congestive heart failure and then having an arrhythmia and needing a defibrillator And so living 30 years with chronic disease from heart problems, that's different, right?
Right.
And the incidence of chronic disease in this country, as you know, is, unbelievable, really.
Yeah.
And so the less chronic disease we can have, the better our lifespan will be in terms of health span, right? Being able to do what we want to do. So if we want to hike with grandkids or travel or be independent till we're in our 90s, we have to be healthy, right?
Yeah.
And it's never too late and it's never too early to start thinking about that.
Yeah. Thank you so much. Because that's most of our listeners are people who, live big lives now and want to continue on and are looking forward at all the fun they want to have. Yeah.
And the other piece I think is important is that women are busy taking care of everybody else, right?
Yeah.
And often we're the last on the list to take care of. But we have to be healthy to take care of everybody else, right? So
Yes.
if we're going to be vibrant and active, we have to get our screening tests, whether those are mammograms or colorectal screening. We need to get our lipids checked, maybe do some imaging for vascular disease. So all these things should be on our radar, right?
Right. Right. So let's talk a little bit about cholesterol as long as we're here. What does preventive cardiology and interacting with cholesterol mean?
Yeah. So, right. So it's a big question with lots of different answers, right? And this is what I try to explain to people how I help people. Because when I see someone in the office or on video, we talk about your personal risk, right? So things like cholesterol numbers and, these sort of broad topics, those are population-based metrics, right? So they're good initial numbers to look at. But if we really want to know about you and your risk, not only do we look at total cholesterol, HDL, LDL, and triglycerides, which are the numbers that we see on a standard lipid panel that most people are familiar with, right? But in my clinic, we dive deeper, right? Because we all know those people that, their father died of a heart attack in his 50s and their brother had a heart attack and they get their cholesterol checked and their doctor tells them it's fine. I don't know why they died, but your cholesterol looks great. Well, maybe not. So if we take a deeper dive, there are new markers that are important. We know Lp(a) is one, ApoB, all the inflammatory markers, because we know that atherosclerosis, so heart disease, it's not only that cholesterol plaque that people build up in arteries, but that plaque becomes inflamed, aggravated, inflamed, and that's what leads to plaque rupture and forming a blood clot in an artery and an acute event like a stroke or heart attack. So not only do we want your cholesterol to be good, but we want to know what your inflammatory markers are. So again, you have inflammation in the body that can be aggravating that plaque and lead to plaque rupture. So it's a multifaceted thing, right? So it's not just your LDL cholesterol needs to be this. Again, it depends on your other medical history, your other cardiac risk factors, what these other markers look like when we take a deeper dive. So it's not an easy question to answer, right?
Right.
Because to personalize it, we need to know your specific numbers.
Right. And my husband went to his primary care doctor and asked about some of these extra tests, and he was told, I can't even order those.
Right.
So it's, sometimes your primary care doctor may have read about them, but may not even be able to get them.
Right. And they may probably what they're talking about is that even though, and this is speaking of soapboxes, even though cardiovascular disease is the number one killer of men and women worldwide, not just in the United States, but there's not a standard protocol for cardiovascular screening beyond the standard lipid panel. Right. So again, like we have mammograms to screen for breast cancer, and we have colorectal screening to screen for colorectal cancer. There is your insurance doesn't recommend and will not pay for everyone to get a CT calcium score to look for calcium in their arteries.
Right.
So again, you really have to go outside the traditional healthcare system. And this is a problem because I think we've been conditioned to think, well, if my insurance doesn't pay for it, it must not be important.
Right.
Right. Or if my doctor said he can't order those tests, I must not need them. It's not that simple, really.
Right. We even have, that speaking of the CT calcium score, if it was recommended, we have some places now that do just that for like $100 or $150.
That's right. Yeah.
Which is so different than going to a hospital to have something done where it's, astronomical prices.
That's right. And that's part of what I recommend in my practice. So not only do we do those advanced lipid panels to see your personal risk based on those markers and labs, then we also do some sort of imaging. Because again, high cholesterol and high Lp(a) and high ApoB, those are, quote, bad. But it still doesn't tell us what your arteries look like, right?
Right.
I mean, it can tell us if you're higher risk, but it doesn't tell us exactly what your arteries look like. Well, there are tests to look at that. Again, your insurance isn't going to pay for them because they're screening tests, but you can get them. So the different types of tests that I tell people about, one is a carotid test, right? Carotid intimal thickness. So that's where we take a picture of the carotid arteries in the neck. We know that people with plaque or thickness even of the carotid, that's associated with increased cardiovascular risk. So that's a good tool. But still, that's a surrogate because, we're not looking directly at the heart arteries, right? Now, there are tests to look directly at the heart arteries. One is the calcium score. In most places, you can find this for $100 and you just go get it. You don't have to have it ordered by your primary care doctor. So that's a great screening tool. You get some radiation exposure with that test, but it's low. And it'll tell you if you have calcification in your heart arteries, and that's not normal. So any calcification is abnormal. Now we know that your risk goes up as your calcium score goes up. But again, it helps us put people in different risk categories and tells us what's going on with you.
Nice.
Now, the downside of a CT calcium score is that it picks up hard calcified plaque, but not soft plaque. So there are different kinds of plaque. There's the hard calcified plaque that's considered the more stable plaque. And then there's the soft plaque that's more unstable, more inflamed, more likely to rupture and cause acute problems. So the CT calcium score it only sees the hard calcified plaque. It can't see the soft plaque. So then there's a test called a coronary CTA of the coronary CT scan that you get some a little more radiation with that test. We give you some IV contrast or dye, as people call it, and it circulates in your heart arteries, and we get great pictures of your arteries, even like 3-dimensional pictures. They're awesome. They can look inside the heart arteries and see if there's plaque inside there. And then the best thing, we take that CTA picture and combine it with some sort of software analysis, like Clearly is a good example, where it tells us not only where the plaque is, what percent blockage you have, but what type of plaque is it? Is it hard plaque, soft plaque, mixed plaque? So again, at the end of all that, we know exactly what's going on with you and your heart and how best to manage that.
Nice.
Yeah.
Well, so I'm guessing that these tests, though, also are not necessarily recommended for everyone. And so it's a good idea to talk to someone like yourself.
Yeah, I don't know. It depends on how you look at it, right?
Yeah.
I mean, if you're 30 and you don't have any issues, maybe not. But, if you're 50 and maybe your cholesterol is a little high and maybe your grandma had a heart attack and you want to know what's going on with you, then maybe you do need something, right? Because again, if you think about it as the same in terms of a mammogram, right? So mammograms are recommended for all women, no matter what, right? I mean,
Right.
so I think at some point we'll get there with cardiovascular screening because again, it's the number one killer of men and women and the incidence goes up. It's not going down. So whatever we're doing, we're not finding these people before they have their cardiac events, right?
Right. Thank you
And
for
again, it's 2024. We have the technology to look at things. We're just not looking at things.
Gotcha. So before we leave cholesterol, I promised we would talk about the cholesterol level of babies. So anyone who's been reading Peter Attia's Outlive book talks about how babies have cholesterol of 10 to 20, LDL of 10 to 20. And in our medical world, we get recommended to have an LDL below 100. So could you comment about that?
Yeah. And again, it kind of depends. People with known cardiovascular disease, we recommend that you even get your LDLs down around 50.
Nice.
And some people worry, some about the new drugs we have can get your LDLs that low and even lower. And, some people worry, are we getting LDLs too low? So there's some people have concerns about that, but that example of babies have LDLs 10 to 20, and so do rabbits, by the way. We know that babies, their brain is developing at those times more than any other time, and their brains do great with LDLs of 10 and 20. So that's a good argument that low is good. Also, across the globe, there are populations of people, those tribes they find back in the Amazon or whatever.
Yeah.
And their LDLs are 30 to 50 just naturally.
Okay. Eating that traditional diet and active.
The high cholesterol levels that Americans have, that's not normal.
That is such a great perspective. Wow. So what are the lifestyle pillars that are helpful for heart health?
Right. So we do, let's say you come see me, and we do all those advanced lipids and we do some imaging and we see that you have 20 to 30% plaque in one of your heart arteries. What do we do next? Right.
Yeah.
So that's where all the pillars of lifestyle medicine are the foundation. Because this is stuff everybody needs to do anyway, right? Whether you have coronary disease or not. Because these pillars, not only do they help prevent and reverse heart disease, but they also help prevent cancer and obesity and diabetes and Alzheimer's. So these are good pillars for everyone to know and to practice. So the first one is whole food plant-based diet. So I advocate for more things in their natural state, right? So less animals and animal products, low fat, less processed foods. So fruits and vegetables, legumes, beans, nuts and seeds, lentils, whole grains. So brown grains, right? So quinoa and brown rice and farro and barley, all those old ancient things, right?
Nice.
So if we make that the basis of our diet, your cholesterol will be lower, your blood pressure will be lower because you'll have less salt and less sugar in your diet. Your weight will be easier to manage. So it's a good place to start, right? With the whole food plant-based diet. Which, the standard American diet or the SAD diet, as we say, is typically not that, right? So most Americans don't get near enough fiber because we're not eating enough fruits and vegetables, grains. So, and we know that increased fiber is associated with decreased risk of breast cancer. So again, there are lots of reasons to eat this healthy diet.
Sure.
And I tell people to start where they are, right? So if they're eating meat once or twice a day, every day, which most Americans are, start with a meatless Monday, right? So every Monday, that'll be your day to eat Maybe make your tacos with brown rice and black beans instead of the ground beef or the chicken, right? So it gives you a way to experiment with different foods, try new recipes. So I think that's a great place to start.
Can we just touch a moment on fats, because we're not talking about low fat packaged foods.
Correct.
And we can have things like avocado. We can use olive oil in our cooking.
Yes.
Things are still safe for us, right?
Yeah. So, fats, I mean, they got to go back and forth on this, but we know that. So the healthy fats like olive oil, right, are the basis of Mediterranean diets, the historical Mediterranean diet, not buckets of white pasta, but right. So the Mediterranean diet that was olive oil based, we know that type of diet is associated with decreased cardiovascular risk. So yes, and avocados, those are considered the healthy fats.
We can sprinkle nuts on things. Yeah.
Right.
We can sprinkle nuts on our
That's right.
yogurt and okay.
Yeah. Now some cardiologists and plant-based experts, they worry about any oil. So like Dr. Esselstyn, who wrote Reverse and Prevent Heart Disease, or Prevent and Reverse Heart Disease, he says no oils whatsoever. Dr. Barnard, who does the Physicians Committee for Responsible Medicine, I don't think he likes many oils. But again, the other issue with oils is they're higher in calories, right? So it's a lot of calories per a small amount. So a little spritz of olive oil on your broccoli before you air fry it, I do that. But do I blob no. So you have to kind of be smart about it. But yes, and nuts and seeds, those are all good for you.
Great. Thanks. Okay. What's next for pillars?
Next is exercise. So move more, right? So, and again, it doesn't have to be, you don't have to sign up for the gym, but 30-minute walk in nature every day is great for our physical health and our mental health. Some of the longest lived societies, the blue zones, right? You've heard those. They incorporate movement into their everyday life, right? So they garden, they sweep the floor, they sit on the floor, they're just more active in their daily life. So this is a good thing to remember, because again, as a society, we're very sedentary, right? We're sitting all day at work, and we come home and sit and watch TV for a couple hours. So we need to try to remember to move more. So set your alarm, and every 45 minutes, do 2 minutes of jumping jacks or lunges, just something to get your blood pumping.
Yeah. And I love too, going back to the advice you have for eating is to start where you are and something. Because I was reading that women at midlife are some of the most inconsistent exercisers. So give yourself a lot of empathy for that, and try, one thing this week that you want to try.
Right. That's right. Try something and try something different. If you haven't been doing yoga, try yoga for a week or two. And then if you decide you don't like it, try something else, So there are a lot of resources, YouTube videos, Qigong, you can look up different things. I do Japanese morning radio exercises every morning to wake me up. So there are just a lot of different things to try. So just experiment. Maybe it's something you hadn't tried and you might like it.
Nice.
Yeah.
What else?
So third is restorative sleep. So that's the third piece. We know that bad sleep, sleep disorders are linked to heart disease. They cause elevated blood pressure, abnormal heart rhythms, congestive heart failure, and sleep apnea can even cause stroke and sudden death. So there's a strong correlation between poor sleep, sleep disordered breathing, and heart disease. Not only that, but sleep is when our brains heal, right? They get rid of all the toxins from the day. And so we need good restorative sleep. Poor sleep, like sleep apnea, increases inflammation in the body. So again, that's another connection with inflammation. So I screen most of my people for sleep apnea. these days, you don't have to go spend the night in sleep lab like you used to, right?
Thank goodness.
Hooked up all this stuff. I mean, nobody could sleep well in that scenario. But these days they have different devices, a sleep image ring that you can wear for 5 nights, a watch pad device that you wear for 1 night. They measure vascular tone and your heart rhythm. Even like something like an Oura ring or a whoop strap can measure, tell your oxygen level while you're sleeping. So there are lots of ways to look at it these days.
Nice. In my world of weight loss too, it's also, we have to hit it because again, I have people who can't lose weight and it's sleep apnea or some other sort of sleep. Yeah. Anything else we need to be thinking about?
Yeah. So the other important things are stress. Stress is another pillar of lifestyle medicine and something that I address with everyone. Because again, acute stress is great, right? It's our body's response to swerving out of the way when a car's coming at you, right? So you get this rush of adrenaline and you're focused in and you can get out of the way, and that's what it's for.
Yeah.
So, but in modern life, we're bombarded with all things all the time, right? So finances and our job and our kids and our elderly parents and wars on the other side of the world. We see all this all the time, and our brains, we weren't meant for that, right?
Yeah.
So what happens is we get this elevation of cortisol and adrenaline, those acute stress hormones. They're elevated when they're not supposed to be. So the state of chronic stress. And again, those hormones can increase inflammation in the body, which again is related to heart disease. So we need to work on this. Dedicate time in your day for your self-care things, whether that be journaling or reading for pleasure or taking a warm bath or, meditating.
Getting together with a friend.
Yes, whatever gives you pleasure and relaxes you. I mean, and we all know those things, right? We can feel them when it happens. But again, often those things go last on the list, right?
Yeah.
But put those first on the list. Schedule those things in your day because those are as important as everything else, maybe more.
And exercise can help us be an active de-stress as well, right? Which, nice.
Yeah. So you can kill 2 birds with 1 stone there.
That's right. So you can be so efficient.
Yes, that's right.
As we all want to be so efficient.
Yes. What else? So the other pillar, another one, there are 6 of them. So the next one is social connection, right? So this is related to everything, relaxation and stress management. We know that people who, again, blue zones are a great example of this. Blue zone, people who live in blue zones have strong social connection. So whether that's through clubs or places of worship or family, again, 2,000 years ago, humans lived in little tribes of people, right? And most of those people you were related to, and everybody helped care for everyone. And now everyone's separated and it's harder to do. So we really sometimes have to make an effort to be more socially connected. But it's good for your physical health and your mental health.
Yeah. I think I really noticed that. And I hear that from my clients when you had an in-person job and then you went to working from home. Yeah. You had to think, where's my social connection?
Right.
You had to be on the list of things to schedule.
That's right.
Yeah.
And then the last one is avoiding risky substances. So, things like don't smoke cigarettes. Hopefully everybody knows by now that that's bad and horrible for your health.
Yeah.
Alcohol, I don't recommend that people drink any alcohol, right? So, we used to say that a glass of wine or 2 was good for your heart, right?
Yeah.
So they revisited that data last year, I think, and, it's kind of sketchy. And it's a slippery slope. When people hear their doctors say you can have a glass or 2 of wine, well, my doctor said I can drink. So now it's 3 or 4 glasses and then a bottle of wine, so to me that's a slippery slope. And, we know that alcohol is a toxin to the heart, right? People who drink a lot of alcohol can get a cardiomyopathy from that. So weakening of the heart muscle from alcohol. And when they stop drinking alcohol, their heart function recovers. So, alcohol increases blood pressure, increases triglycerides. It's not good for brain health, messes up our balance. So
Yeah. Tough on menopause symptoms, makes them all
yes,
worse. Yeah.
right. Calories, it's empty calories. We don't need sugar.
Right. Right.
Yeah.
Well,
And the
thank you.
marijuana is the last one. I always mention that because that's kind of a big deal now that marijuana is becoming legal in more places. A lot of people find marijuana is helpful for anxiety or pain.
Mhm.
But the data coming out on cardiovascular effects of marijuana is not good. Increases abnormal heart rhythms and blood pressure. And there was a study recently where it increased heart attack and stroke. So there's not a lot of data, but what we have so far is not looking great. So I tell people just to pay attention to that and keep your eye out for stuff coming out about that.
Okay. Thank you so much. Anything else you want to tell people before we go? Before we close?
Well, yeah, I would just say that, the American Heart Association estimates that 80 to 90% of cardiovascular disease is preventable through lifestyle modification. So that's whether everybody in the family has heart attacks or you have elevated blood pressure, high cholesterol. We can modify those things. We can work on those things and improve those things. And you can live a long life in good health. So that's the more empowering message that I want people to get, right? That there's a ton of stuff that we can do for our health.
And you can even improve wherever you are right now.
Yes.
You can improve, right? You're never a lost cause.
Nope. Never.
Yeah. Beautiful.
Yeah.
Thank you so much, Dr. Paeschke. I loved everything you talked about today. I think it's super interesting. And, there's so much more new technology for prevention now. It's super exciting.
Yeah.
Thank you.
Yes. And I hope people embrace that more, that prevention is the key it's much easier to prevent disease than to treat it. Right. So that's.
And what type of people come see you in your office?
Well, a variety of people. So sometimes maybe they get a cholesterol checked with their primary care physician and it's high and they'll come see me to and maybe their primary care doctor gives them a prescription for Lipitor and says, take this and see you in a year. Well, a lot of people, what's the other part of it?
Yeah.
Maybe I have to take Lipitor, but what else can I be doing? Or maybe if I do something else, I don't have to take Lipitor, right? So those are the kinds of things we talk about. Maybe someone who has a strong family history of heart disease and they're worried that they're headed down that same path. Mm-hmm. And then, so those are like the primary prevention people that I see. Yeah. And then the other people are what we call secondary prevention. So maybe they've already had a cardiac event. Had a heart attack in his 50s and he sees his cardiologist once a year and they talk for 20 minutes and he doesn't have time to get all his questions answered and he doesn't really know why he had a heart attack and can someone explain that to him a little better? So I sit down with all my models and my slides and we go through all of it, right?
Nice.
So I spend an hour and a half with people on their initial consultation and we just talk about all the stuff. So
very nice.
Again, it's kind of a teacher too, right? Teaching people about heart disease and what it is and what it means and how to either not get it or how to reverse up what you already have or not have a second event.
Very nice. I live in a big metro here in Minnesota. So I can Google preventive cardiology and there are a number of clinics.
Yeah.
So for people who can't come see you, you may have it near you and you just might not have looked. But I appreciate everything you said today. Thank you so much.
Thank you.
Please let people know how they can connect with you.
Sure. So my website's a good resource. So www.hearthealth.care. That's probably the best place. I have some free resources on there for people, some downloads, and that's how you can. I offer a free health consultation, 30-minute health consultation with people to sort of talk more about what's going on with you specifically, and you can schedule that through my website. Great. And then people can email me info@hearthealth.care.
Great. And what states do you serve?
So I'm licensed in 7 states: Colorado, Arizona, Utah, Wyoming, Idaho, Nevada, and Oklahoma.
Great. Thank you. I will make sure that for everyone that this information on how to connect with you is in the show notes as well. So you can just click right over.
Okay.
So thank you again. It's been a great conversation.
Thank you.